couple more minutes before we're going to make a start. Too. So it's 12:30. We're going to make a start. So welcome to everybody who's already joined us to another Meet and Connect session on this lovely Monday afternoon. So today we're going to focus on our CAMHS service and the early to moderate mental health intervention, as you can see. We're joined by Jackie Alexander and Zoe Gilbert, who will be introducing themselves and who will be going and presenting the CAMHS services they'll be focusing on today. Just a few housekeeping rules. So good to see that everybody's on mute and got cameras on. So people presenting will have their cameras on. So you can cameras for everybody who's attended, cameras off. People who will be presenting will have their cameras on. So we will be recording the session because there will be people who can't join us today but want to hear about the service, and so we're recording the session and then publishing it on the Safeguarding Partnership website for other people to have a listen to, or if there's anything you missed or want to re-listen to, you can kind of go to the website and re-listen to that. You can interact with us today through the chat function. So if you've got any questions while Jackie or Zoe going through the presentation, then pop your question or your comment into the chat function and we will pick that up with both of them at the end of this presentation. Following today's meeting, you will get an email with the PowerPoint presentation in, so you'll have all the information that you've seen today sent to you directly, as well as a link to our evaluation form. So if I can ask people to take a couple of minutes to complete the evaluation form, that will help us to inform future sessions or how we can improve these kind of live events. So that'd be really appreciated. So I think we can make a start. So without further ado, I would like to welcome Zoe and Jackie, who will be going through the services and how to access them. Welcome both.
Thanks, Isabel. Okay, so can we have the next slide, please, Lorna? Okay, so we're going to showcase the early intervention to low-level mental health teens today. So typically up until about 2016, CAMHS was what everybody knew it to be as the moderate to severe mental health service. But around about 2016, as I said, we were asked to start thinking about early intervention and low-level services. What we're going to talk about today are the Educational Mental Health Support Team, which is the new model that's going into schools, and the Positive Steps Low to Moderate Mental Health Intervention Team, and how both of those services are incorporating the CYP IAPT project, which, to explain the abbreviation, is the Improved Access to Psychological Therapies. What we're not going to talk about today is CAMHS or the iCAMHS service. They will be discussed on Friday in that session. Okay, so what many of you may be familiar with is the tiered system that we tend to use in mental health. So you'll probably be familiar with CAMHS as being the tier 3 service. What we're going to be talking about today is tier 1.5 through to tier 2.5. So the Positive Steps team is the tier 2 service and incorporates the CBT, which typically works at a tier 2.5 level, and the New School team, which is actually coming in between the tier 1 and Positive Steps. So it's roughly about a tier 1.5 service. Obviously, we don't talk in tiers anymore. We talk more about streamlined services and how we make sure that there are no gaps in any of our provisions. And I'm going to talk to you a little bit about what the CYP IAP programme is and how that's important to these two services. Next slide, please, Lorna. Okay, so this is quite a busy slide, but it actually demonstrates the vision mapping for the IAPT programme. So basically what the IAPT programme is, as I said, is the improved access to psychological therapies, and it basically works on 5 principles, and those principles are participation, access, outcome monitoring, evidence-based practice and availability. So basically what that means in simple terms was we were asked to ensure that a young person is able to access the most appropriate service in the quickest time possible, using a variety of locations and times, and ensuring that they receive the best possible service that they can have. And we know that through evidence-based practice and through outcome monitoring. So basically the whole IAPT programme is keeping the child at the centre of everything we do. So what we had to start thinking about was how we can widen out the access for young people, knowing full well that we needed to bring more young people into mental health services at some point in the future. It was about giving them more options and more availability to see clinicians if that was what was needed. So you'll see from the vision mapping here on this screen that if we look at access in particular, that there talks about the early intervention into schools, which is the new team that I'm going to talk about. It's making sure that there's documentation and information available to them should they need it. And then it's about making sure through availability that actually we don't just think about 9 a.m. till 5 p.m, that actually parents can get children here at 8 a.m. in the morning, or that Saturdays are probably better. So we've had to think about broadening out the offer of the hours that we give. Obviously, all the treatments that we provide are evidence-based. So we have a full evidence-based practice set of interventions that we use. And the IAPT programme is actually using CBT in particular, which is the cognitive behavioural therapy. And we know CBT is particularly effective for the treatment of anxiety, as an example. But within the IAPT programme, we actually have lots of other interventions. So we train wellbeing practitioners, we train EABs, they're enhanced evidence-based practitioners, and we also train people to deliver systemic family practice, which is a lower level to the family therapy that we would offer at tier 3 level, but actually starts to think about actually it's not just the child that may need help, but actually the family as well. Obviously, everything we deliver throughout all the CAMHS portfolio, we, as I said, keep the child at the centre of everything that we do. And it's really important that the child has a voice in everything that we deliver. So we do participation, we bring young people into the service, and they actually have a voice about what we deliver, even down to things about the waiting room at Canalside. You know, they don't like the seats, they wanted a television, they wanted water machines. All that kind of thing is really important for us to develop as part of the offer we give to young people. Why it's important for us to tell you about the IAPT programme is that because the IAPT, as I said, is encompassed within the New School model and within Positive Steps, and that will become a little bit more evident as we move through. Next slide, please, Lorna. Okay, so the New School model is called the Educational Mental Health Support Team. It will have a new snazzy name, which we are likely to tell people about September, October time. The point to this service is that obviously we need to be able to get early intervention and identification, more importantly, into young people within the school settings. Obviously, we know that children spend a lot of time at school, and teachers will spot things that necessarily parents don't. So it was really important that we could get in there quick and work with the teachers to support the young people. Each model will serve a population of 8,000 students. Now that sounds quite a lot, but if we think about it in Walsall terms, that is roughly between 13 and 15 schools that we were asked to work with. Not every child in every school is going to need any support. So obviously we work to the number of children that are in the school setting, but actually we think along the lines of only 500 children will possibly need an evidence-based intervention through this new team. What the expectation of the team is that we actually increase the access to about 23,500 children across the Midlands. And again, that's a massive number. But if you think along the lines of at the moment across Dudley and Walsall CAMHS, we have roughly about 3,500 children with us. And then if you make that across the Midlands, actually the number is a little bit more realistic. What the new team will deliver is face-to-face. And there are some key interventions that they will deliver, which I'll go through in a little while. And also they'll do group work and they'll offer parenting classes. So what's really important about this team is that actually it's not solely concentrated on the young person, but actually maybe the parent that needs a little bit of support. Or it could even be a teacher that actually has got a young person in their class that they're really struggling to manage. But it could just be behaviours that need a little bit of support from a practitioner. So this offer will broaden out right through from teachers to the young person to the parents. The new team is due to arrive next year, 2021. It is slightly delayed, and that is because of COVID. They are all busy doing their training, etc. at the moment, and they should have been finished for December, but that's had to be extended till March. We anticipate they've started to make links with the schools already, but we anticipate they will be fully functional in the schools from the 1st of April. However, that's whatever way that's going to look, because we're not entirely clear yet. We've done this as a Black Country model. So Walsall, Dudley, Sandwell and Wolverhampton, we've all worked together to deliver the same. So all 4 localities have got exactly the same model going into them. And what's really unique about our model is that we're doing it in collaboration with educational psychology. And we're the only team in the whole of the country to do that, because predominantly people have just put a CAMHS model in place. But we thought it was really important to work collaboratively with our partners, and that is proving really successful. The team will consist of low and high intensity workers. So when we talk about low intensity, we talk about the educational mental health practitioners who are being trained to deliver the self-guided help, and then we've got the high intensity workers who will deliver the CBT at a slightly higher level. Again, I'll show you that in a little bit more detail. What was required was that each school that we worked with had to identify a school lead for mental health, and that was a teacher or a SENCO or a pastoral lead who was in a decision-making role and would work with the team to be able to identify young people who are just showing those signs of needing some support or they've got some concerns about. And then they would flag them up to this team and work out the best possible intervention for them to be offered. That also, should I say, should be done jointly with the school nurse, because the expectation is that there is also always a piece of work done with school nursing before they access any kind of mental health team or support. Next slide, please, Lorna. Okay, so this just gives a very brief idea. This is the team, and I've put the names into the team so people can know who they're expecting. Andrew Wesley is the overall clinical lead, and he's working across Dudley and Walsall, so he'll know what's going on in both areas. And then we are looking forward to welcoming Vanessa, who will be the team leader in post on the 28th of September. And we are interviewing for the Band 6 post next week, I think it is. And then underneath here, you'll see the 4 educational mental health practitioners, and they are currently, as I said, just finishing their training at university and will be trained in that low-level intervention and self-guided help. And then you can see along there in the orange boxes, they are our educational psychology colleagues, and we work absolutely in tandem with everything we deliver for this model, and we'll continue to do that going forward. So down the right hand side of this slide, I've just mentioned a couple of key areas about this team. It's really important for people to know that the new EMHT is in addition to any existing provision that a school currently accesses. So if a school is accessing a school nurse, educational psychology, or even paying for counselling sessions, the expectation is that that does not stop, but that this team works in tandem with those services that are already there. And we worked as a panel to agree on the schools that we were going to take forward with this model, because we needed to build on a foundation that would already be in place. And the schools that we're working with are absolutely fantastic. The educational mental health practitioners will offer a 6-session model of self-guided help, and then at the end of that, if it's felt that anything more was needed, they can then be stepped up to the high intensity workers within that model. And as you can see there, they are the CBT staff. They're all trained in high intensity CBT, and they will all be trained to supervise CBT as well. And then, of course, obviously, we then have the pathways for escalation after that. Next slide, please, Lorna. So these are the schools that we're going to be working with. We have just found out that we've been successful in the second bid for the mental health support team. However, we've only been awarded 2 models across the 4 areas. So we're just trying to work out which areas are going to get the next model. If it is Walsall, obviously we will then work with the schools again to agree the next set of schools that will be part of this model as well. But we were really, really pleased with the amount of schools that came forward initially to be part of this scheme. I think it's going to be very, very successful going forward. I think on the next round we would like to see more secondary schools that we will bring in as well, more academies. Next slide, please, Lorna. And just to round up the slides about the new school model, I've included here the referral criteria, including who can refer into the service, along with the pathway. The pathway is not something you'll be able to read on the screen very clearly, so you'll probably need to read that when you get the slides. But obviously, the people who can refer into the model are the pastoral leads or the SENCOs via the school mental health lead. The school nurse can refer in, the educational psychologist within the school, and also Positive Steps will be able to step down into the model as well. Just underneath there are a brief set of criteria which the team will pick up. So it is that very low level set of difficulties around emerging behaviour, low mood, worry management. It could just be something along the lines of friendship difficulties. We know through trend data that we've seen Positive Steps that there are some key trends around certain age groups, and obviously friendship difficulties become a little bit more predominant in girls when they go into senior school, so it could just be something as simple as that. What I will say from the pathway, without going into any great detail, is that obviously there are always escalation processes involved in every pathway that we have, and obviously the key escalation process for this pathway is Positive Steps. So if they do need anything more than what this model can deliver, it will be escalated into Positive Steps. Next slide, please, Lorna. Over to you, Jackie.
Okay, so I think it's important to note that this links in perfectly with what Zoe's just been talking about not having any gaps in any services. So Positive Steps will now link on to the education and mental health support teams. And this is the next level, like Zoe said about the tier 2.5 service now. So the picture is that 9.8% of 5 to 16-year-olds have a mental health condition. Now, you've probably read this lots and lots of times, but the expectation is that 35% of young people will need to access a mental health service by 2021. So you can see that there's a degree of responsibility onto this team to make sure that 35% of young people access and get support as needed. So the requirement is to offer early help and targeted service. So they will work with universal services, and as Zoe explained, it comes with the school nurses into the education and mental health support teams, then into Positive Steps. We're trying to avoid them jumping straight to CAMHS, so they access the services when it's required. What we want to do is de-escalate emerging issues as soon as possible. So early intervention, prevention, and we've all heard that many times. And we want to prevent the need for specialist CAMHS services. Specialist CAMHS services, which we're going to talk about on Friday, is overloaded, but sometimes it's because those children are very low level, not to underestimate their needs, but they shouldn't be in a CAMHS tier 3 service. So to talk about the Walsall offer, so this is a service for young people with low to moderate mental health needs. So the tier 2.5, so the stepped approach that we talk about. And this time we're offered between 8 to 10 sessions as a standard. And we're offering an extensive group programme, managing emotions. And this programme is for individual work, it can be group work, it can be parent work, or it can be work to talk with professionals themselves. And as I said earlier, it is working with universal services to make sure that this programme goes out and is offered to everybody. Included in that is support to parents, because it's always that we address the needs of the child, but then the parents need to understand and be part of that pathway, the care plan, to help put that support in place. They're the people that know the children better than anybody, like the teachers, so they need to be on board. So we have the same approach, we're all using the same approach. We're going to provide training opportunities to other professionals. So if schools identify that they need training in a particular area, it could be a piece of training that we do with school nurses for the mental health school service and Positive Steps, but we do it together so it's consistent. But we'd like schools to identify what they'd like us to do the training on. So it's you highlighting the things for us to be able to then present to yourselves. And linking with other agencies to provide a streamlined service. We all know that if we all work together, we have much better outcomes for our young people and their families. It's when there's a split in the way we work, and it's about bringing those splits together and working very closely together and understanding what those splits are all about. Next slide, please. So this is again showing the Positive Steps staffing structure, which is on my left. So we've got 2 Band 7 leads, and then as you can see, that's all the other staff underneath that they concentrate mostly on the CBT, and I know Zoe's explained what CBT means, and the systemic family practice. So those are the main areas which we know are to address the mental health needs of children in schools for anxiety, low mood, behaviour issues, which is when we've done lots of audits, those are the main areas of concern that come out. So approximately 1/3 of referrals are for 8 to 9-year-old boys with anger and behaviour issues. So this is where the CBT comes into play, and it's very successful because of the IAPT models that people are being trained up on. And approximately 1/3 of referrals for 12-year-old girls with anxiety issues. Now, if you can just think about that and the times when 8 to 9-year-olds for boys and 12-year-olds for girls, puberty and everything, you know, it's very understandable why they come in at certain times and ages. And it's just good to look at the referral split there, depending on what area you as professionals work in, just so you know. And what we've done with the staffing structure, people are allocated to the different areas. So, you know, it is good for you to get to know who those people are that work in those certain areas, so you can give them a call and ask them for advice and support, and perhaps talking to them about different issues that you're finding in the different areas that you work in as well. GPs make up 43% of all referrals into positive steps, with 16% being referred from school nursing. To be honest, what we'd like to do is change that around a little bit. We think it should be coming more from school nursing and the new education and mental health support teams. We think that it should be coming through this new pathway now, so they should be highlighted. Parents shouldn't need to go to the GP. We know from lots of other talks that Zoe and I have given that GPs are overwhelmed with the amount of referrals they have to make. We've got a clear pathway now, which means that there's support coming in the correct way, and that's through the school nurses. The school nurses do their piece of work and it goes up the ladder, or down the ladder, as we like to think of it. The longest wait for first assessment is currently 12 weeks from referral. This is consistent, and even during COVID times it's been consistent. We've still got that 12 weeks wait. Even though COVID's hit, we've got children that are still being seen, even though we're having to do the work virtually. We're seeing people on a virtual platform, so we can still offer them individual work. We can still offer parent work. What we're not doing at the moment is offering the group work, but a lot of work's going on to see if that's possible in the future, because as we're all aware, we will have to continue in this way of working for a lot of months to come. So during COVID, we've remained open, we've remained seeing these children, so making sure that we still have somewhere for these children's needs to be addressed. We would like the referrals to be seen earlier, but as you can imagine, we've been quite overwhelmed with referrals into the service, more complex needs. So as Zoe's rightly put there, referral levels have remained consistent during the start of COVID, and all about the sessions being offered virtually. Can I just say, some of the parents and children have refused to be seen virtually. Those are the ones that we have been seeing face to face, even though sometimes if they've been low level. And the reason we've done that is just to check out the risk element, because it's not until you cast eyes on the patients or talk to the parents that you really get a feel of if there is any risk and they do need to go up to tier 3 or down to a lower level. Next slide, please. So this is the referral criteria and pathway. It'd be good, and as you can't really see it properly, but when it comes round to you, we're more than happy to talk to you through it. And it shows here the different pathways that can come through. And what we do, we talk as if it's a step ladder or a lift, so it can come up or down at any particular time. And as we said earlier, 43% from the GP. Some are coming into positive steps through the new education and mental health support teams, but then some get stepped down from CAMHS tier 3. So it is a tiered approach to make sure that their needs are being met at the most appropriate service. Can I just say, on the odd occasion, we have to have quite a few services involved, and that's because sometimes when you unpick it, there's layered approaches that we need to take, but we do that also. So who can refer to positive steps? So school nurses, they're going to be one of our main point of contacts, GPs, community paediatricians, educational mental health support team, and tier 3. So that's where we're on about the tiered approach. And we want it to come through this pathway to make sure, like we've said previously, that the right approach is at the right time for these young people and their families. The referral criteria, low level phobia. If you're unsure about that, we have got a more detailed criteria that you can have a copy of. First level mental health input. So it's not normally somebody that's had extensive tier 3 overdoses. At crisis point, it's more low level. If they have had a crisis and it's been stepped down, then that's different, but it's making sure, again, we're coming at the right pace. Goal setting in specific areas, which we are more than happy to do. And what we want to do, as I said, is work with professionals, parents and the child alongside these teams to make sure everybody has a copy of the care plan, so it's consistent as well and everybody works in the same way. With short-term goals on psychoeducation as well, low-level self-esteem, stress, low mood, and all those things that are common within the school environment. Can I just say on one thing that Zoe and I have spoken about numerous times is the amount of children since we've had COVID have not had the same issues in school. So I do think in the future there will be a massive piece of work we will have to do about why children have been less anxious due to not being at school, because that's been very noticeable in the last few months. Next slide, please. Sorry, I know I've only got a minute to say, so I don't know if we want to open it up, and that was just quickly just summing up positive steps, which links in perfectly. And you have got our contact details. We do have a shared email address as well, which people are more than happy for professionals to get in touch with us if anybody ever wants to ask a question. And just to reiterate, we have a duty worker on duty every day for anybody to check things out with.
Okay, thank you, Jackie. Thank you, Joey. Zoe, we've had quite a few questions coming through. Just a question about the new service in school. So a specific question about Blue Coat Federation. Does that include Blue Coat Church of England Secondary Academy? Can you confirm or clarify?
Okay, it actually doesn't include the academy. The academy didn't apply for the service. Whether they will on the next round, hopefully they will. But no, it is only for the nursery, infants and juniors.
Thank you, Zoe. So I think this has been clarified, but just to reiterate, so the referral into positive steps, I think you kind of said the main people that can refer to is school health, social workers and GPs. That's right, isn't it? Is there any other agency that can refer into the service, or is it only those three?
It is that mainly those three, and the reason we've done that is to make sure they've accessed the lower level services first. So really everything should go through the school nurse first of all, and the school nurse can escalate it up for us. But what we're finding is school nurses aren't aware of referrals most of the time. This way it's to stop that from happening. So school nurses will know exactly where these children are and where they're getting the support from.
Okay, so a question then attached to that, Zoe and Jackie. So most children will be in school, and that's kind of an easy pathway forward. And I think it's quite important that the school and school health have got sight of that. We have got some young people who are not on roll through our children missing education or kind of waiting of a school placement. They may not have a social worker, but obviously they will have a caseworker either in an early help or education. For those young people, is there, other than the GP, is there another, can they ring up the duty and talk through a service?
Yeah, I mean, we're more than happy to do that, to be honest. We don't want any child to miss out on any service they need. So that's something that we have thought about it, but to be honest, we're trying to encourage most children to be known. And even though they're not enrolled, even though they're not on roll, they should be known by some service, or the previous school should have linked in with us or something. So, but we're more than happy to talk about that and to pick children up. We would never say no to any child.
Great, thank you. Just a question, I think you might have mentioned this, but what age range will Positive Step, or does Positive Step work with?
5 to 18s.
Okay. So that's clear. What staff will staff that provide the service? So this is about the early help services. So we know when they're in CAMHS that they attend child protection conferences. Does that count for the Positive Steps staff as well? Will they attend reviews and child protection conferences? So look after children reviews and child protection conferences.
Can I just say that I'm going to say yes, but I'm hoping it's not very many, because we think that if they're on child protection, that it may be a little bit higher in the levels of support. So saying that, we don't know till we pick children up. So we're hoping they won't attend many, because it's a short-term intervention between, remember we said between up to 10 sessions. So I think they should not be in Positive Steps if that's the case. If it's child protection, it's more higher level, but we never know, do we?
Yeah, I think sometimes for especially when it gets to teenagers, child protection, it might still be covering that Positive Step threshold for yourselves. So it's important that the social worker communicates with the Positive Step people and get that communication going, that partnership. So going back on your chart that you've kind of helpfully put out, I think familiarizing with the people in the service and then making that connection is really important. Question: can we refer for anger, behaviour and poor communication?
Into which team, Isabel? Do we know?
Possibly into the Positive Steps team, I think, because the first service you talked about, the new service, because they'll be linking it with schools. I think they'll have a whole school approach and looking at what the issues are. Right. And looking, I think specifically for Positive Steps, can we refer in for anger, behaviour and poor communication?
Again, can I just say it depends on the level, because the anger should be addressed in school first. What we're finding, we're having too many children referred in for anger problems, where you need to look at the environment with the child if it's school related. If it's school related, we'd need to put strategies into place to help think about the school environment and change the environment. If it's different to that and we think it's more emotional to do with family backgrounds, trauma or anything that is more higher level, yes, so we would contemplate on that. But I think that's why we're trying to again think about what level they go on depending on what type of anger it is.
And I think it kind of, I don't know if the person that asked the question, but there might be others in this webinar today that were in the Little Meet and Connect session with WPH and CAMHS. So it's about seeing it, and we've got school health. We had school health presenting as well a couple of weeks ago. So I think it's really important that you see the range of mental health services, and you think about the young person you're working with, their needs and where they're best placed to support with. So I think Jackie and Zoe lead on a service that's CAMHS related, but there are other services there that maybe meet that lower level need. So have a think about what is the cause, you know, what needs to happen, and at what level does that support need to happen. And CAMHS, for instance, talked about their intervention around anger and kind of the resources there online for children and young people, well, for young people, and school health did the same. So they've got a number of group work projects and one-to-one support that they can offer to those young people. So I think, Jackie, you're right, it's about understanding the need of that child rather than just referring for behaviour and anger. So that would be our call out to you all in this session. So next question is, when's the next round for application for schools for the new IAPT service? And how are schools going? How it says how were schools made aware, but I think the question is how will schools be made aware of the application? So it's looking forward.
Okay, so the previous round, Sharon actually linked me with the appropriate people in the council to send around to all schools. So all schools were contacted. It will be done exactly the same way as last time, so that all schools hear at exactly the same time. I'm just waiting to find out whether we are going to have the next team for Walsall. I should know that hopefully within the next 4 weeks. And as soon as I know that, if Walsall is the successful one, then I will be out to everybody by the first week of October.
Yeah, so the main links so for school people that are in, I think our main communication is the daily brief that we've been sending out through our school governance people, which is Duncan. We also use the link, and then we target specific. So as this service is linked to our education psychologist service, it's likely to go out to all Senkos in school as well to make you aware of that. So that's normally the routes out. If you don't think that's the right thing and we can be better in communication, let us know how to do that, and then we can incorporate that into the next round of communication. Just one last question, Dan. I know we've gone a little bit over time, but I think it's important to cover all the question. Is can looked after children health refer into the positive step service?
Absolutely, yes. There should be no reason they should be treated no differently.
Yeah,
yes.
But I guess the social worker, as all looked after children will have a social worker, their social worker can refer into as well. So you've got two routes.
But again, yes, it is the social worker, but can the social worker make sure they go through the school nurse again and make sure that it's being addressed lower level before we come up to positive steps, please? I think it's really important that we start to address it at the right level rather than jumping. And it could be that's the right level, but let's just make sure we go through the pathway, please.
Absolutely. And again, a reiteration, so from the feedback we get from children, young people and families, sometimes that low level referral helps them to acknowledge some of the issues and the needs, start to work on it. And then when we make the right referrals into CAMHS, either positive steps or maybe some higher referrals, is that we've got that engagement sorted, because it's probably fair to say that you still, even where it meets the threshold and we offer a service, that we have some no engagement because we haven't really prepared children and families for that service, and it can be quite scary to children and young people to open up to a new person about issues around mental health and well-being. So having those conversations, making that first step, looking at who you can pull in, whether it's school health or an online resource, or the other services that we talked about, is really important to think about before you refer into positive steps. So yeah, so that was the last.
Can I just make an important point that you've just raised? I think the difference is as well, it's to get children's confidence to start to trust us. So I know we can't at the moment, but we're going into schools, we do it at different community settings. We don't normally do those pieces of work in CAMHS. The idea of these teams is to be in the community. That's essential to work wherever you want us to work. So we're trying to do that more. I know we can't at the moment for COVID, but it's to try and get the confidence in the children to trust us. And that's a big piece of work. So if we can all do that, that'd be amazing.
Great, thank you. Yeah, quite a few comments saying thank you for a very informative and useful session. So thank you both for making the time.
No problem.
And for people that have joined us on Friday, Zoe and Jackie will be with us again. Is it both you two again? Yeah, to talk about the tier 3 mental health services in terms of CAMHS, so the more specialists. So come and join us for that one. And if you know of anybody that would benefit, point them to the safeguarding website for the recordings. We will send you an email with all the information. Please take some time to complete the evaluation form as well. That would be much appreciated. So thank you all for joining us, and maybe see you on Friday. Have a good week.
Thank you.
Bye.
See you.
Bye.
Bye.
See you, Joey. See you, Jackie. See you on Friday.
Bye. Bye.
See you later.